Jisikilize.
My voice is heavy.
Which heavy?
It's bass.
Umenisikia hapa kwa voice note ninaongea hata unaweza sema ni mwanaume ndo anaongea.
Hello everybody.
Hapo nilijaribu kuweka sababu. Venye nilisikia ningehota. Acha niongee venye nimezoea. Acha niongee vile nimezoea.
Guys, welcome to the Soundmind podcast. Today we are going to be talking about mental health. This month being a mental health awareness month, so I have brought in some guests that are going to help us to understand what mental health is all about. So welcome on board and let's have a good ride. So we are going to be talking about just giving an understanding to what mental health is all about. I know in the over the years, or due to the impact of COVID-19 in our country, majority of the people have been suffering or have been going through mental health problems. Some even getting into depression and even dying. So it's something that we need to talk about and let people know what it is. So I'll just welcome you on board to let's understand what mental health is all about. Simaloy.
Thank you. I'm Simaloy Catherine, and I'm so excited to be here today. And me defining mental health, I'll go by the World Health Organization. The one that says that mental health includes emotional, psychological, and social well-being, whereby they do help us to understand how to handle things and to handle the stresses that we're going through over the life. So to me, mental health is the being sound mind and feeling emotional safe, and also be able to handle the things that you're having or the things that you're going through in life.
Thank you so much. My name is Teresia Washira, and according to my own understanding, mental health is psychological, emotional, and physical well-being. That means that as a person, you're able to make informed and good decisions in your life. That is when you're mentally stable.
Perfect. Does it mean when I'm not able to maybe make decisions on my own, or does it like there are people that in their system, they are not people that are able to give you answers that you need instantly? Can you say that this person is suffering from mental health, or it's just a character of this guy?
So I feel like it doesn't have to be mental health, because some of these decisions that we have to make in our lives, they take time. Mm-hmm. There are these decisions that you don't really have to give someone an answer at that particular moment. But when I say making good decisions in your life when you're mentally stable, that means that as a person, your own self, you're able to make a good decision about your own life. It can be in different categories. So when you ask me a question and I'm not able to answer you right now, or when you are doing this interview and I'm not able to answer you that question, that does not mean that I'm not mentally stable. Mm-hmm. Yes. So in decision making, it is in a different category of our life. That means that when I'm seated down at my house, or when I'm having a chat with my friends, or there are some things that I want to do in my life, I can make that decision without depending on another person. That is from my own understanding, yes. Okay,
perfect. And majority, according to the statistics that we have seen during the COVID-19 period, we understand that there are some factors that even influence that may make someone to get into such a situation be suffering from mental health. There are some external factors that may influence this. So what are some of the things that I should look out for? That if I see someone going through this, I say, maybe this person has started having mental issues, or they are shouting but we cannot understand whatever they are saying. Similar.
Yeah, for sure, COVID-19 has actually made a number of us, including maybe some of us, or maybe some of our colleagues, to actually suffer mentally. But there are those who went to extreme and they were unable to handle, or they were unable to be able to know that now I'm suffering and this is what I need to do. So for me, I think when you see someone, or maybe you see someone who's close to you, maybe things have started changing and you realize this person needs help. But remember, you wouldn't go telling someone that I think you're suffering from mental health, now I want to help you. You can't do that. You just have to do an observation, and maybe you can just be there, you can watch, you can try and listen to the stories, whatever they're telling. And from the stories, that's when you will realize that this person is really suffering. And I think the best way that have actually helped a number of those people who've been suffering. I know some of us have gone through the acute stress. That was okay because it is the normal things that are happening in life. But there are those, some of the, I don't know, it's kind of process that you're going to use. Maybe try and talk about your life before COVID. Start from when COVID started, afterwards. That way you will find yourself, you're trying actually to be, maybe, let's say, mentally well or sound, something like that. Yeah.
Yes. So that is important. I was listening to another podcast of a friend. I don't know whether you've heard the podcast from Kimani Mbugua. This guy was famous in 2018, 2017. He was a very famous guy, apparently, but this guy was suffering because of the fame that came with the presents that he was receiving. So he would find other alternatives to this mental problem. He said he will go maybe start using medicines, like he will take bangi, marijuana, so to at least keep himself in a state that he cannot control anything. So do you think some people may be suffering through mental health, but they are not showing it to the people that are close to them? They are suffering with it internally. Maybe they are finding things that they are going to use to depress this.
Yes, I heard about that story, and it is true. Some people suffer, and they know they are suffering, and they are going to look for ways or mechanisms to depress and to try and hide their feelings. Some might be suffering mentally and they are not even aware. Let me talk about the ones who know their sufferings. The reason as to why they will not talk about their issues, it's because of different things, like let's say social status, fame, where you come from. You might be scared to talk about the things that you're going through. And because when you look back, you tell yourself, you know, I was like this, now I'm like this. So when I start talking about my problems, maybe I can lose my fame, I can lose my job, I'm going to lose my career. So they look for mechanisms and ways to avoid talking about what they are going through. Number two, the second category is the category that suffers and they don't know that they are suffering. And most of these people, it will take another person to understand and know that they are going through something that they are not even aware of. They might get even to depression and they are not even aware. These people might, maybe they used to do something before, now they are not doing it, but they are not even aware. That is why it is very important to take care of your friends and to always check on your friends. Because as an outgoing person, and now you're not outgoing anymore, you are an extrovert, and I'm not saying that all extroverts are they are not
Stable.
mentally stable. What I'm saying is that my friend here, Simaloi, might be outgoing. I know her as an outgoing person. She's always out there. She's always, doing things and challenging herself. But all of a sudden, she's in the house. She doesn't get out of bed. She doesn't want to eat or do anything. I'll be worried because I know her. So it will take me as her friend to know that she's not doing well. And that is where I will start probing and try and understand and know how I'm going to help her. So if you're going through something and you're not even aware, it will take your friends. But if you're going through something and you know it, it is good to always speak out and seek for help.
But sometimes you find that you have friends who don't know you're suffering from mental health.
Because
Yeah.
they have not stayed around someone.
Yeah.
Yeah, they've not. They are there. You are suffering. You want. Do I tell them that there's something happening, or should I continue keeping quiet? Such things.
Perfect. So we can say, what are some of the triggers for this? Does someone just wake up and start suffering from mental health, or there are things that may trigger someone to start having mental health issues? Maybe the environment that I'm living in. Maybe I'm a child in an abusive marriage or something. At the moment, at that age, I may not understand what it is, but you may find as I grow, as I get older, I can remember what happened. So every time that I get into a place that people are confronting themselves, it triggers that. And it can, we say, that will affect the decision making of the person, the mental health of the person as it grows, depending on the environment that they are in. Yes, any of you can answer that.
Let me go first. Well, you said whether someone would wake up one day and realize, oh, I'm mental. I'm having a problem with my mental health. Well, it doesn't happen like that. If actually, I use your example, if I am in a violent home and every day I'm seeing this and this happening, and at a time I will grow up and then I will start now realizing what was happening, well, that we can call it trauma. But talking about mental health, remember, we have different types of stress. We have the daily or the normal stress, which they are called acute. That one you can handle. For example, you woke up very late and you're worried that what time will I get to work, what will my bosses do. So that one you will just arrive and maybe you'll find that, oh, I'm safe. So that's done.
What if you're not safe?
You are, because
What if I got there late?
You get there late. Of course, you will tell the boss, this and this happened. Maybe it's traffic, or maybe I overslept. You will try to reason together.
Do you think, let me just maintain there at the job environment.
Okay.
Do you think majority of the mental problems come out of our work environment? Because maybe you get stressed a lot at the workplace.
I think I wouldn't say majority is from our workplaces. I think, let me say what I am thinking. Most of people who are actually suffering from mental health, it starts from home, your family. You're waking up every day, you're trying to make ends meet, and then you go out there. You know how the world is, especially now post-COVID-19. We lost jobs and now we are trying to recover. So I will walk out looking for something to bring back at home. You get home, you find a significant other, you try to explain, it is not understood, and then now you start, can I say, lack of a better word, throwing words. They will start piercing. And what next? You will start finding yourself with a lot of questions, thoughts. What should I do? Am I supposed to go through this? So I think where we actually find ourselves getting, what triggers mental health mostly is the abuses that come from home, or maybe the kind of thing they were going through at our home. Maybe Tess can tell us.
More.
Yeah, so yes, you said about children who grow up in abusive and violent homes. These children at that particular age, they are not able to understand or to process whatever is going on with their families or with them. So as they grow older, they will have this mentality of this is how a family looks like. Because if I was brought up in a violent family, every time I hear the word family, I will always associate that family with violence and abuse and beating one another or throwing words, abusing each other. So this child will not have any interest of ever having a family or wanting to get a family. Let me give an example of girls who are raped at a very young age. When they are raped, they will always think of men as people who rape. So even if they get older, they will not want to get married. Why? Because they know if I associate myself with this guy, this is what they are going to do to me. And it takes a lot of work and a lot of processing and a lot of help, like professional help from professional counselors, to be able to explain to this person that not all men are like that. And it will take time. So you will find that if you're mentally unstable because of something that you see, chances are high you experienced it as a child. It was hidden somewhere in your unconscious mind. You're not able to process it as a young person. But when you grow older, when you're an adult, you're able now to understand and know. If it is a family, you are going to be afraid to get into a family. If maybe you are abused or maybe raped, you're always going to have that fear in you. So this will bring mental instability, and to avoid this mental instability, these people will try and avoid that kind of life. If it's getting married, I don't want to get married. If it's having a family, I don't want to have a family. So that happens, especially when it happened to you as a child. Yes.
Perfect. That is a very good illustration. And now, how do we diagnose someone? How do we tell this person is suffering from mental health? Do we just conclude by looking at their character? Like you said, there's someone that used to be extrovert, now he's becoming introvert. Maybe some things may have influenced the decision that he akaanza kuwa introvert. So what do we use to diagnose someone?
So there's a tool that is used to measure depression, and for depression, most of the time it is feeling of hopelessness, sad, sorrowful. You're beating yourself up for a period of 2 weeks. So in this period of 2 weeks, that is when a counselor, a professional, is going to diagnose you with depression. So there's a tool that is used professionally by all professional counselors to measure and know if you have severe depression or moderate depression, or a depression that is just at the start, the beginning of depression. But for those who have severe depression, that means they've been having depression and they're not even aware. They don't even know they have depression. So maybe when there's intervention, that is when you just use that kit and that tool. That is when you realize that they have severe depression. Yes, so there's a tool that is used by counselors. Yes.
Great. Simaloi?
I'll just say the same thing. Of course, there's a tool, but also physical examination. It also works. Maybe you become sick and I don't know what's really happening, so you go to the hospital and the doctor will actually examine you, and we want to know what is really happening. So with a few questions that he or she will ask will help him understand what you're going through. Also, maybe we can say, I don't know whether it is already known, but we can say maybe the test, maybe the lab test or something, they will also help. And also, you can realize by being with someone, maybe they have high and low moods. There's excess fear. See, there's isolation, such.
Perfect. So we have looked at the triggers. We have looked at how do we know that someone is going through this. So are there any cures that are available for persons that are going through mental problems? Let's start with Tesh.
Yeah, there are. Let me take an example of depression. Depression has a cure, and if you are not going to involve a psychiatrist, we use psychotherapy. That is where we just talk to the person as a counselor. You talk to the person, you engage, you interact, you know what the problem is, and then I know the best way to help that person. But there are cases where we are going to involve a psychiatrist, and the psychiatrist is going to prescribe medicines and that are going to assist the person. So as a counselor, I'm not in a position to prescribe any medicine. So if I feel there is intervention needed by a psychiatrist, what we do, we refer this person to the psychiatrist. And then the psychiatrist is going to read the report that I have given to them, and then they're going to know the best medication to prescribe to this person. So yes, there is a cure, and talking about it is what we do mostly in Kenya. Psychotherapy is used more in Kenya. Talking to the counselor, going for a walk, having sessions, and with time, these people recover slowly by slowly. Yes.
Okay. Simaloi, do you think there are any remedies to this? Like cure
Cure,
for
yeah.
mental health?
Yeah, there is cognitive therapy. We have also the one that she said, the psychotherapy, where you will have to meet with the psychiatrist. He or she will take you through the session, and definitely at the end of the day, maybe we will have we'll be able to see them mild, or maybe you'll be completely well.
Okay.
Yeah.
And now the biggest challenge maybe that we may face, or that we may be having in our country, or maybe in the African setup, is that we are not brought up in an environment where we are able to communicate our issues, especially the men. We are not able to communicate our problems, maybe that we may be, our thoughts that we may be having. So even when you're telling someone that they need to seek help, maybe to go talk to someone about their mental issues, or go see a psychiatrist, it becomes a problem. It becomes a burden for them, some of them. So they choose to maybe either die with their problem or find an alternative to it. So what other ways that we can use to introduce, apart from just creating an awareness about mental health, to introduce someone at a younger age to understand that it gets to a point in your life that you may find yourself going through this, and this is how you're going to solve it? Yes.
Well, I think the reason as to why we actually we think that most men are suffering from depression, it's because they are given, they are being told that when ni mwanaume, like unalia aje, unataka kuji-expose, you see. Those are the things that are making most of the African men to get depressed. But I think the best way we can start doing this, it's from the grassroots. If I realize that when these guys reaching to this age, they're finding it hard to actually talk about themselves, and they're also not trusting anybody with their issues, then let's start from the lower classes, or let's start from the grade 1 or grade 2. Start training these kids. Tell them that when you have an issue, speak it out, because you will find that this thing, you will grow with it. You grow knowing mimi ni mwanaume na sitaambia mtu chochote. But when you reach at that age, let me say, because most of these men are dying not teenage, but
in their
let's say youth, their youth.
yes.
Most of them who are dying. And when you're reaching to that point, you're unable to control everything. You're just there. I do not know what to do. I don't know how I'm going to start, because these things have piled. And you're wondering if for example, and the other thing, you find that the reason as to why these things are piling, it's because we don't trust each other. Because I will come and talk to you, and then I will get out there and everybody will be like looking at me suspiciously, and I'll be like, what is happening? Because whatever I told you, I entrusted it with you, but you didn't honor the trust. You just decided to go and spread the whole story. So other than me having anxiety, then I would rather keep my secret, or I'd rather stay with whatever is bothering me. But if we do not want things to get escalated to that point, then let us start from the grassroots. Let us have those organizations that are advocating for mental health. Let them start training these kids as young as they are. Because when you reach to maybe you're now turning 18 years old, you are now able to understand that whenever I'm going through this thing, then I have or I can see a counselor, or I can talk to a religious person, or I can talk to maybe a teacher, or maybe I can talk to someone who I trust, or someone who can actually help me.
Perfect. Do you have anything to add?
No, I feel she has said the most important things that are supposed to be done. That, men should stop, beating their chest. They say, I'm the man.
Mwanaume ni kuwa ngumu.
Yeah, what we say here in Kenya is that me yule msee mwanaume ni kukauka. So I think that should start. It should be trained when young kids are like as low as like PP1, or they should be. These teachers should show the kids, and especially the young boys, that when something is wrong, it is okay to talk about something when it is wrong. It is not bad at all to talk about what you're going through, or to say maybe so and so did this to me. Even when you realize that boys, even the young ones, they'll solve their problems. They'll not come to class, crying so and so did something. But the girls will come, teacher, this one did this to me. But the boys, it's in the field, they'll fight and they'll come back to class, and that's that. Yeah. So this kid will go back home. They still have that pain in their mind. They're like, oh, he did this to me, but I cannot talk about it because, I'm a boy. I'm supposed to be strong. They beat their chest, they sleep, and that's that. So I feel it should be changed, especially in our African setup.
Yeah, and yes. I think with the new curriculum that we've been given, the CBC one, I think it's handling all of these things. They're starting doing it all the way from PP1. They're training the kids, and I am sure with the generation that we are going to raise, maybe in the next, let's say in the next 10 years, then actually we will have
better conversations about this.
Some of these conversations will be out there. Everybody will be aware.
Perfect. And